Okay, so welcome everyone who is potentially listening. Thank you for joining us for another little podcast. Hopefully, this will be informative for everyone who's listening. Maybe it'll get some more insight. Maybe it'll get you thinking about some different things. I brought back on one of my previous bosses and now good friend and mentor, Tim Eilers again. Tim has had a lot of healthcare experience through his life. He's worked with a lot of different individuals of all abilities, and he's ultimately just got a lot of good knowledge and perspective in his brain that I can appreciate and hopefully takes from today. So, the topic that he actually brought up to mind, which I think is super, super important and prevalent in today's society, is the topic of preventative medicine. And I kind of wanted to start with just what is preventative medicine as a starting point. So I looked this up on Google. I just typed in preventative medicine. So just a quick what Google says. Preventative medicine is a medical specialty recognized by the American Board of Medical Specialties, which focuses on the health of individuals and communities. The goal of preventative medicine is to promote health and well-being and prevent disease, disability, and death. I think that's a pretty good definition, but it's pretty like generic and binary, and it's just like, oh yeah, they want to make everyone healthier, right? I have kind of a different perspective on it, or at least what I kind of look at it as. And preventative medicine to me is doing things in your control in daily life that prevent you from actually needing real medicine and intervention in basically stopping chronic disease, aging, etc. So essentially doing little tiny things like that to become healthier yourself. Tim, I don't know if you have kind of a different perspective on this. I'd love to hear it, or just
No,
generally what you think.
well, I agree with you. I think for the everyday consumer, the person who's not a medical professional, um, looking at preventative medicine, I think your definition, is going to be a lot better for those people. It's going to be the things that you can do to um, help try and prevent, the occurrence of any potential diseases or things of that from developing later on. So, I mean, one of the number one things obviously with exercise helps prevent all cause mortality from a ton of different diseases, so that's going to be one of the top things. But no, I mean, I agree. I agree with you that it's what people can do to I think empower themselves in their own lives as well.
Yeah, absolutely. And that's bringing in kind of the mental aspect of things, which I think is super, super important and often overlooked too when it comes to uh, preventive medicine and just health in general. It's all about like these blood markers and if their blood sugar is a certain level or this and that, but like the mental aspect is also huge and can trickle into the physical aspect as well. So,
Mhm.
now that we got that kind of covered, the current struggles in the world and preventative medicine. So, one of the things that Tim and I have had a lot of conversation about is just the mindset of individuals right now, and they instead of wanting to take control of their life, they almost want to have stuff done for them on multiple accords. And I think this rings true, especially for their health. For example, if someone is, feeling a little tired or they're getting a little bit of aches and pains or feeling weak, their sleep's bad, etc., you go down the list of different things, they're going to immediately think, I need to go see the doctor. I need to have some intervention. I need a special pill. I need this or that, instead of kind of looking at themselves. And at the same time, I actually think the current medical system kind of plays into this. And, I'm not going to say like big pharma is like out to get everything, but it really is a huge issue because a lot of times you will go to a doctor and, they want to help you. So to help you, they might give you like a pill to lower your blood sugar. they might give you something to make the pain go away for a little bit, but unfortunately, like the underlying issue might not be addressed to a certain extent. Um, Tim, I don't know if you have any kind of thoughts or add-ons, just like the current state of the world and just kind of how people perceive medicine and how they get treatment. I feel like I might have jumped it a little bit there, but
Oh, sure. But I understand what you're saying. I mean, if you just watch TV, you're going to see pharmaceutical commercials, whether you, are actively thinking I'm seeking this or not. If you're sitting there and you're feeling whatever, like say lethargic or whatever, and you just happen to have TV on, the things that are going to be presented to you are not going to be, you're going to get more energy if you go out and you exercise. And here's the scientific reason why. It's going to be funded by some things like pharmaceutical companies. So that's what people see and what people hear. And so I think that, that becomes their first response. One thing I think that's kind of important, just worth mentioning relative to medications is, working in the wellness field, I've talked with a lot of people who like, if I talk to someone and they say like, oh, my blood pressure's, completely under control, let's say. Sometimes they'll fail to even mention to me, that they're actually taking blood pressure medications. And if you're doing like risk stratification for, health, if someone is on a blood pressure medication, that's considered essentially the same as that person having high blood pressure. I mean, it just adds better than them having high blood pressure. But as like a risk stratification, that's another, strike. And I think, people are so used to the world of medicine that they think, if I take this medication, and again, I'm not saying, medication's bad, it's better to, have it under
yeah,
control.
should be treated. Yeah.
Exactly. But, I think people are more willing, to go to those sources before, there's ways that they could do that without putting themselves on medication, which if you don't, actively address that high blood pressure, it's not going to get better unless you address it with, diet and exercise. And, medication helps too. But, if you continue living your lifestyle in the same way that you were, it's not going to get better unless you change things.
Yeah, no, I'm glad you actually brought up that point because it makes me think of the people who are like, um, yeah, I'm totally healthy. I'm totally fine. And they're so focused on just like now, like the right now, I feel fine. I feel like I'm in control of my health. But in reality, they may be taking blood thinners, diabetes medication, potentially a whole host of other things, maybe lipidemia. You could go down the list of all these different medications that people need to basically stay like at bay. Like it's basically like a drug cocktail every day. And to some extent, as you get older and stuff, some of these things are relatively inevitable. And to what degree you can actually completely like stave off all metabolic issues, especially as you get like to 100 or whatever, is hard. But if you're 55, 60, whatever, that's still relatively young. I mean, based off of life expectancy, you still have like 20 good years left of your life to be on all these medications and just thinking that everything's going to be okay because it's controlled now, even though in 10 years maybe your doses go up, maybe you add another medication. It's kind of frightening, and it's scary to think that people think that's okay in my eyes. When
Well,
they're I Go ahead.
and I do think it's just important to mention, and I know that you feel the same way too, that obviously that there are genetic factors that contribute to that too. So as we talk about preventative medicine, there are as we talk about exercise preventing the occurrence of diseases or the onset of them. Remembering that just there are genetic things that would make people more predisposed to those, but kind of back on topic to what you were saying. Shoot, I just had a brain fart there for a second. um Pardon me. Can you just refresh me? What were you just finishing up with? I got
We're just basically people not taking control last
okay.
20 years of their life. Yeah.
Yeah. All right. So, and then it also comes down to, not just quantity of life, but quality of life. And I think that's another thing where people don't always think about the long-term effects of, uh, it's not necessarily, having to join a gym or something like that, but just staying, physically active and taking care of yourself. That's going to allow you to best enjoy, potentially with, time with your grandkids, or just, things that you enjoy doing. How many people have we worked with who, at an earlier age than, we would have expected or thought, gave up some passion things like gardening because, someone had like a hip replacement, and then, they were too nervous to put themselves in a position, which is totally understandable. But if you don't commit to these things, it's going to have a negative impact on your life in the long term.
Yeah. I just literally today saw this article that the CrossFit Games, they have like an age group qualifier for like masters divisions, which is like the older divisions. And the oldest masters athlete competed in this qualifier. And I think they said he was like 74 years old, which is
Wow.
like insane to me. I saw this one guy one time too. It was like a 70 or 80-year-old, like just, I mean, he was an old dude, but he was on a skateboard and he was doing the downhill skateboarding. And I said to myself, I'm like, I want to be like that. Like, that is so cool. And I mean, how many, medication do you think that guy's on? I mean, how many aches and pains do you think he's on? Like, no, he's moving well because he's moved well his whole life, and he's just taking initiative and control of the things he, can do to keep up with that. So I don't know,
Well,
just a couple cool examples of
well,
stuff that I think is neat.
I think I remember me and you, I think, have had this discussion before. I used to train a gentleman, Chuckhuss, who I believe was out of Iowa City, who attempted to climb Everest twice. I don't believe he ever actually summited, but he was very, very close. I think in his 70s when he was doing it.
Yeah.
And he, I remember he came to like my grade school when I was a kid, and he was, old to me then. And he did something like he'd walk on his hands to go get his mail back or something. It was something kind of
Gotta start
strange.
doing that.
But he was just a guy who challenged himself, and I ended up working with him when I was older, training him, and me and him would go cross country skiing together. He was a monster. He would work me. It's something that, not everyone obviously has the same opportunities as everyone else, but you can take more control of your life than I think a lot of people realize that they can.
Yeah. No, definitely. And a lot of these things are very low hanging fruit. I'm not saying you got to go climb Everest or even train to do something like that. You don't even have to have a specific goal otherwise than just saying, I want to be able to continually live life in a healthy and meaningful way where I can do the things I want to do without having to rely on pain pills or medication and, taking the XYZ 3 times a day for the rest of my life. I mean, I can safely say, at least in my eyes, like I feel like if most people could avoid that to begin with, they would absolutely enjoy that. So, kind of the next stuff we're going to talk about is just some simple forms of what I would call quote unquote preventative medicine. And a lot of this stuff you're kind of preached at numerous different times from numerous different angles. But I think kind of looking at it as a preventative medicine instead of just something you do to be healthy is kind of a different takeaway potentially for older individuals or people who are just on a bunch of medication right now can look at it. So the first one Tim actually mentioned earlier was exercise, and there's seriously just a mountain of evidence of the good effects that exercise can do for your body, whether it's reducing the risk of heart disease, um, reducing blood sugar in your body, essentially. So, reducing the risk of insulin resistance and diabetes, a whole host of other things, not even to mention the mental benefits. I'm kind of blanking on some. Can you think of any other like benefits to exercise, at least preventative medicine wise? I tried to tell like heart disease and blood sugar is the first thing that
So
always comes to my mind.
like cholesterol, so raises HDL, lowers
Yeah.
LDL, LDL. It lowers the risk actually for anything that could be caused by circulation issues. So
Yeah.
even potential, you had talked about mental things, but even, I believe that's the reason even for uh, some of the resistance to some diseases is due to, the capacity for blood to be pumped, into the brain
Sure.
and into areas in the body. So, I mean, it's really most things, and just generally as a rule of thumb, exercise, as long as done properly, reduces all cause mortality
Yeah.
significantly.
Yep.
Uh,
Yeah, and when we say exercise, we are not referring to people going out and killing themselves and um, doing something that really makes them super, super uncomfortable. It's just hitting the basic guidelines given to us by ACSM, or basically public health, which is 150 moderate minutes of exercise of aerobic activity a week. So, like walking or jogging, and then just resistance training 2 times a week, full body, one set. And these rates of exertion are very, very low for the health benefits we can get from exercising. So just keep in mind, a very, very easy thing that you can add into your life. 150 minutes of walking a week, I think, is very reasonable for most people. And then twice a week, full body workout. What would that take? Like 20, maybe 30 minutes, depending on like what kind of equipment you have. Uh, so again, and something I actually didn't even mention too, we kind of talked about like the metabolic issues, but when it comes to like musculoskeletal, exercise also helps with that too, because having good tendon and joint and just muscle strength will ultimately lead to better joint integrity as we get older, potentially avoiding a lot of hip replacements, knee replacements, maybe even pain pills from just having like backaches and stuff. Being stronger and physically fit helps everything in your body. So, just kind of something I thought about and wanted to touch on.
yeah, it absolutely does. And I know we have discussed before, I used to, when I worked at Mercy Hospital, I even would work with, individuals before they would go in for knee replacement or hip replacement, because to have the strength and mobility beforehand, even if you are in a position where you need that, helps tremendously. Um, Something else I'd like to mention, well, we talked about, quality of life, and strength is going to help with, balance, just your ability to do things. But also even with younger individuals, when do you know off the top of your head when peak bone density hits for men and women? Something like
Oh,
20.
I was gonna say like mid 20s.
I was going to say something around 25, definitely
Yeah,
before.
that's what I was thinking.
Um, so I mean, peak bone density hits, at a very young age. So even if, if you're looking at preventative medicine, and I would say, especially if you're a female, looking at preventative medicine, weightlifting, strength training, putting some, tension on your bones, because just women are at a higher risk for that as they age, to really work on their bone density. And the stereotypes that we see, whatever, I think they're changing a little bit now in our society, but it used to be, girls do more cardio, guys do more weights.
Yeah.
Really, you look at, if we're looking at the preventative medicine side of things, men suffer from more long-term cardiovascular diseases, heart attacks, strokes, things of that nature, and women suffer from more musculoskeletal things, falls, breaks, osteoporosis, things of that nature. So when you're looking at the preventative medicine of things, I think that it's important for women of all ages, especially, like I said, young women also, to commit to doing strength training.
Yeah, that's a super good point. I forgot about osteoporosis. That's like one of the super high things that happens as you get older, and especially the people who do have osteoporosis, if they do fall, the chances of them again being disabled for the rest of their lives is very, very high as you get older. So good,
Mm.
very good point to bring up.
And I had the statistics in front of me right now, but I know me and you have discussed them before. But it's, people hear the story, grandma falling and breaking a hip. Like that's a story that we're
Yeah.
kind of familiar with. A very high percentage of those, I want to say like over 50%, but again, I wish I had the statistics in front of me, but an alarming percentage of them are actually people's hips breaking just under the pressure of their own weight and then them falling because of that. It's not actually the fall that caused it, because that's how brittle the bones can
Yeah.
become. So, I mean, I just think, that's an important point. And then how quickly people, especially seniors, breaking a hip, how quickly that can turn into disability. It just can happen a lot quicker than you would think, and it can change your life, unfortunately, very quickly.
Yeah, basically overnight.
Mhm.
And it's very scary. It's extremely scary. I mean, you could be a semi younger senior, at least in our eyes, who kind of what I mentioned earlier, around 60, and that type of stuff. I mean, if you don't already have control of it, it could be the beginning of the end, and it's sad. You and I saw it numerous times of people who potentially had a little bit of an injury, and then they were in a wheelchair for a little bit, and it was like, oh, you try to feel, some sympathy for them, but then like in the back of your mind, you're like, geez, this is not good for them, and I don't know if they know how not good it is that they cannot move for the next month. But scary stuff, nonetheless.
Well, um, I like sharing this story because it was mind blowing to me when I was I know I've shared this with you before, but when I was in college, this is just for, thinking about people just not moving at all and the detriment it has to your body. When I played college football at Central College, my roommate was Chad Eisman, the Iceman. He was a free safety for us, and I think he weighed like 210 pounds or 200 pounds or 210 pounds or something like that. And he got pneumonia and then some like complication from pneumonia. I probably not supposed to go into all the, maybe we should block out his name. But anyways, he got, I think it's called ARDS, adult respiratory dysfunction syndrome. But he ended up having to be put into a drug-induced coma for 2 or 3 weeks. I can't remember if it was 2 or 3, but he lost 30 pounds of muscle in 2 weeks, college football player.
Yeah.
And literally we lived a block and a half maybe from the cafeteria, and this guy was a stud athlete. And 2 weeks of complete deconditioning, he'd have to stop and rest, on his way to go to the cafeteria. So I mean, that's obviously an extreme
Yeah.
example, but your
No,
body
it's not
not.
extreme at all. It's not extreme at all because think about it, this guy is how I mean, your college
in
age, 20,
20.
20 whatever. That's like your peak athletic time, right?
Mhm.
And the even if you're not athletic, like you're still probably going to be in the best shape of your life even if you aren't physically active the rest of your life. Just based off of our hormones being optimized, essentially everything is optimized for us to run and just do the best things we can. So if you fast forward to that when you're like 60 plus and your hormones are not optimized to basically live the best, have the most energy, be the best for muscle building, etc., and you have like a fall where just like him, you're bedridden for 2 weeks, the effects are going to be even more drastic than this 20 some year old not even being able to walk outside without taking his sweet time. So that's a really good parallel, and I think a good frame of mind for people to think about.
Yeah, absolutely.
Awesome. Okay, so the next thing I wanted to touch on is kind of the diet portion of this, and diet is diet and exercise are probably the two things that get talked about the most, and for good reason. They're probably the two things that we can very easily do. So diet, one of the first things that comes to mind is the blood sugar aspect of things. So potentially a lot of our diets, at least in the Western world, are very high in processed sugars, very high in saturated fat. And essentially, those two things are very highly correlated with increased risk of heart disease, increased risk of diabetes and blood sugar issues, and potentially other things like kind of that you mentioned, like lethargy. Your diet plays a super huge role in that. Do you have anything to kind of add on that? I feel like if I hear you say something, I'll be triggered. So
Sure. No, I mean, diet's tough because it's such a complex issue to get into, you know. The thing is that with a lot of our, health marketing, people want the, 1 to 2 sentence answers: avoid fat, avoid processed sugars. And, that's the answer. And it unfortunately becomes a little more complex. I mean, those are helpful, guidelines to
sure.
go by. Um, but again, when you look at, preventative medicine, when we look at the American diet, for one, sodium is another thing that is astronomically high generally, in the American diet. Um, Protein, we usually get plenty of, just, for the sake of people, I guess, knowing that. We usually are just a lot heavier in carbohydrates. And you even go back to, you know, 15 years ago, and people were more focused on, avoiding the fats than they were the carbohydrates. So you realize just kind of how things have changed in the Western society. Um, the it's really, and it's an abundance of calories, more than it is,
Probably
fat.
probably one of the main issues, I would say, is just
Yeah,
the overeating.
yeah, it's definitely one of the main issues. But that's, it's the abundance of eating, but it's also, I feel like a lot of people have issues with getting the right nutrients into their body. Um, when I've done, I'm not a dietitian, but when I've worked with people on their diet, just some health counseling and things, just as a general example, if people are trying to get, 3 or 4 servings of vegetables, 2 or 3 servings of fruit a day, most people, when they have breakfast, a lot of people don't have breakfast. People who do have breakfast, a lot of times it's cereal, oatmeal, or like pizza breakfast pizza, or piece of fruit as they're going
Or
out the door.
sugary cereal.
Yeah, lunch a lot of times like a sandwich, even if you have, a side of carrots or something like that. Let's say you had eggs and bacon, a sandwich, a side of carrots. You're going into dinner and you've had no fruits and 1 serving of vegetables.
Yep.
And you want to have, and if that's your daily routine, it's you're missing out on not just, the fibrous things from the vegetables, but also, just a diverse profile of nutrients. I think we get, into habits of kind of eating the same things, which obviously that's easier to do. But a challenge that I think less people think about is that diversity of nutrients, making sure that we're getting in all the things our body needs, to function to its best ability.
Yeah. And a lot of those nutrients he's kind of talking about do play a huge role in like blood sugar regulation, disease risk, specifically stuff like even cancers and stuff, where not a lot of people think that cancer is completely, essentially, that you can do anything to prevent cancer. And although this is kind of true, there are a few different types of cancers that are heavily correlated with poor diet. So colon cancer, breast cancer, um, those are the first two that come to mind. But there's a few different types of cancers that actually can be have the reduced risk from not only eating well but exercising. So yeah, there's a lot of missing nutrients. And another thing I think of too is you mentioned the fibrous portion of it. So constipation is a huge thing that happens through a lot of people. So not only increasing water intake, that's a huge one, but having those fibrous fruits and vegetables, again, instead of relying on going to the doctor and him telling you, yeah, you just need to take this, constipation stool softener or whatever, and you'll be good to go. Instead of addressing the issue, like, okay, why did we get here in the first place? It's because I was dehydrated, because I haven't eaten a fruit or a vegetable in literally 3 days. Like, and I mean, the thing is too, there's a lot of different ways to skin a cat. There's so many different fruits and vegetables out there, and there's so many different ways to increase your water intake. It's finding the stuff that works for you and is essentially sustainable. So yeah, I think that kind of covers diet pretty well, unless you have anything else to add. Well, the next thing when it comes to preventative medicine, that I think gets very, very neglected, and something that I've started to appreciate a lot more is the sleep aspect of just essentially getting enough sleep. And one of the biggest things when it comes to sleep that I've realized in having a few different types of those fitness apps that like tracks your sleep and whatever is that the amount of sleep, excuse me, I should rephrase that. The time you're in bed does not necessarily mean the time you are actually sleeping. So if someone comes up to me and says like, "Oh yeah, I get 8 hours of sleep every night," and then I ask them, "Oh, so you're in bed for like 9 to 10 hours?" And they're like, "Oh no, I'm in bed for 8 hours." I'm like, "Okay, so you probably get like 7, maybe 6.5 hours of sleep." If you have good sleep hygiene and good sleep quality, maybe it's like 7.5. But taking into consideration that those little tosses and turns, technically that's a disruption in your sleep. Getting up to go to the bathroom, maybe that's only like 30 seconds you're doing it, but it's going to take you a few minutes to get back to sleep. Then you're tossing and turning again. Those little micro adjustments really, really add up. So, sleep is something that I think we can all essentially feel the negative health consequences immediately when they happen, which is why I think it's something that's super good to focus on, because diet and exercise sometimes take a while to make you realize that they're doing something good for yourself. But if you have a good night's sleep, you notice that right away. You're ready to take on the day. You're way less irritable. You feel better. Just about every little aspect of your life. Tim, do you have anything to add when it comes to sleep quality or just kind of how it can help us with preventative medicine, either?
Well, I think it's important to remember that you can't make up sleep. I think a lot of us um, sometimes think, if we only get 5 hours of sleep, during the week, and then, on a weekend, we'll sleep for 10 hours to make up for it. It doesn't work that way. Your body needs that sleep each day to properly work, its metabolism, its recovery, for brain function. So it's not something that really you should be, on a regular basis skimping on. It should be something that you try and make a priority, if possible. And, you talked about, being in bed and not going to bed. Um, some just, general thoughts on that. How many people go to bed with their phones now, and look at their phone, they're looking at a screen. The more lights that are around you, that actually will mess with your sleep hormones. So if you're watching TV, if you're looking at your phone, if you're looking at lights, that messes with your body's natural hormones to tell you, it's time to go to sleep. So when you're focusing on your sleep, just some general guidelines to think about is making it, a priority of a time, making sure you unwind beforehand. And a good thing too is trying to make the bedroom an area just for sleep. So when you go in there, your body's kind of conditioned, pre-programmed, to be tired. That's what it does when it goes to that room. If you do a lot of, watching TV in bed or playing video games or whatever it may be, You may be more stimulated when you go into that room. So setting up, relaxing routines can be something that can be really helpful, with easing into a properly well-conditioned sleep.
One of the things that I've changed in my past year when it comes to my sleep habits is not using my phone and actually setting it across the room. And then another thing I bought at the same time was one of those sunrise lamps that it
Oh yeah.
like goes off at night, and then in the morning, like 10 minutes before I want to wake up, it's like slightly dim, and then it gets brighter and brighter until my whole room's super bright. So I've kind of had those two in conjunction where now instead of me looking at my phone for like 30 minutes before I go to bed, I'm just not only filling myself with basically garbage from the internet, but at the same time, just keeping myself awake and potentially more anxious about different things. So my phone's now across the room. I have that light. So then in the morning, the first thing that comes to my mind is that light. And then I know it's time to wake up. The first thing I don't do when I wake up is then grab the phone, spend 20 minutes procrastinating, looking through Instagram and stuff. I go shut off the light. I grab my phone. If I do need to look at it, I'll look at it really quickly. But I'm already up and awake and I'm ready to take on the day. Aside from spending, we'd say 20 minutes before bed, 20 minutes after. That's 40 minutes of just time you're essentially just wasting. I've also tried to transition to reading instead of doing that. And it's so much easier when you just put the phone away from you. Setting up your environment is super, super important. So if you don't have that temptation right next to you and you're already snuggled up in a nice warm bed, even if you're like, "Oh, I do wanna get up to get my phone," you're likely not going to because you're already comfortable and half asleep. So, that's a
Yeah, there.
personal thing that I think has really, really helped, and, if anyone listening could take away at least a little bit of that, highly recommend it.
Yeah. And again, knowing that, getting adequate sleep also, helps with metabolism. It also does help, prevent long-term health issues as well. So, I mean, it is something that's more important than just day-to-day grogginess also.
Yeah, definitely. And, another thing I wanted to touch on too, you mentioned the making up sleep. I think that's super important too because even when it comes to like naps and people filling in these different things throughout the day, like uh, yeah, to some degree they'll help with your feelings of tiredness, potentially recovery if you're like an athlete or someone, but um, that's gonna honestly cause a never-ending cycle of messing up your sleep circadian rhythm to a point where then you're not able to sleep well, and then because you can't sleep well, you're going to feel like you need to take naps during the day too. Something
Mhm.
that I've noticed and talked with people, I've noticed personally in my life too. It's a very vicious cycle to get out of, but it's just again one of those things we try to take control of, had the opportunity to take control of. So good. Okay, so the last thing I wanted to talk about is kind of more the mental aspect of our health, and the form of medicine that I kind of touched on today. Tim might have a couple different ideas, but is basically either meditation or talk therapy, whether that's with a counselor or a psychologist. And often when we think about medicine needed for mental things, it's such as anxiety, depression. Those are kind of the two bell ringers that come to my mind first. But doing these simple things like meditating and even just taking 5 to 10 minutes out of your day to just breathe and relax and realize that everything's okay if you take 5 minutes to just focus on your breathing, if you take some time to talk with a therapist to help reduce anxiety and potentially work on your depression. These are really, really good because one, not only do they address the issues at hand, but two, they really allow you to take control of your life and again not have basically someone outside prescribing you medicine. So it's kind of this reoccurring thing of doing things that we can control in our health, to kind of prevent needing those different types of medicine. Tim, do you have any other ideas for potential just experiences with anxiety and depression. Actually, if you want to tell the story about the one individual with his dog, I think that's a really good one. Um, at Grand Living, there was one of the individuals who was he meditates with his dog. I don't want
Oh
to say
God,
his name, but
I got, yeah, gotcha. Sure. Um, yeah. So specifically, what Logan's referring to is there was an individual that I worked with that I got to start meditating to help lower his blood pressure. Um, and meditation, self-reflection, I think just spending time on yourself, regardless of what that um, is important. And I don't think, when you sit there and you're looking like through Facebook, on your phone, I think sometimes we think of that as like, that's my me time.
yeah,
Um, but I don't, that's not time where you're being able to be, self-reflective, to just kind of gather your thoughts, think through things, be in the moment. It's just something I think a lot of people are challenged with. Um, and whether it's meditation or just making time for things that you enjoy, whether that's interacting with loved ones, eh, I use the example all the time for me, fishing. um Sorry, I got off topic there, but back to the example that Logan was trying to have me address before I got off on my there. um so the individual I was working with had high blood pressure, took excellent care of himself, ate well,
yep,
exercised, um was an individual who I would say was pretty high stress. And when he went to the doctor, he would stress out about his blood pressure being taken, so he had a little bit of white coat syndrome. um, but me and him just worked with, yeah, breathing, calming down, and eventually meditation. And he had a dog that he loved, and so what he would do is he'd have the dog sit in his lap, and he would do meditation every night, and they'd take his blood pressure, and his blood pressure improved significantly. From when we were taking it, there could have been some of that just with, some comfort level of getting his blood pressure taken. But either way, it helped control it, the more as we were taking those readings. So this very serious individual would sit down and meditate with their dog, and that was pretty neat to have them do that and then have them see the benefits from that also.
yeah. And when it comes to like anxiety and depression too, there's a lot then that just scratches the surface, because you or I, the same individual we're talking about here, we look at him as honestly probably one of like the fittest dudes at this place we're working at. He got up every morning, was religious about getting good cardio in, maybe a little bit of weights, kept a healthy body weight. And you would look at him as like, oh, he's that age? Like, there's no way. But then, deep down on the inside, he was still having some blood pressure issues. So I think that's an important thing to note, that just because somebody looks healthy and looks a certain way, there are some things such as blood pressure, and not only blood pressure, it kind of goes hand in hand with anxiety that might be deeper in the surface that you don't necessarily see, and might even think you need to address. But again, doing those simple things, as you mentioned, he took that into his life, took control of it. And I mean, I couldn't imagine him spending more than like 10-15 minutes every night doing this, and it made a huge difference,
Yeah.
which is super profound. There's another individual, I remember he would actually bring his blood pressure cuff to our chair yoga classes and would
Mhm.
check his blood pressure before and after the class. And it wasn't anything like super profound, but I mean, it was like a 5 millimeters of mercury difference from when he started to end, which is like, you know,
Mhm.
not nothing. It's, I don't know. It's very small things that can go a long way. And then also too, when you talk about taking control of your mental health and having a good outlook on life, that makes doing the physical aspects, such as sleeping more, such as eating a better diet and getting out and exercising, that much easier. So it all kind of goes hand in hand. Okay, so that's kind of all I had for content and just stuff to talk about today. I really just wanted to reiterate one more time. It's kind of about a mind shift, excuse me, a mindset shift, and thinking about it in a way of how can I do some stuff to take control of my life in a way that potentially medication might do. So, again, for example, if you have diabetes, if you're at risk for high blood pressure, what are some things that you can do today, tomorrow, and in a month that will help you reduce those things versus going to a doctor today and just having him tell you, hey, you need to take this medication for essentially the rest of your life, whatever. That's not how it goes at the doctor, but that's how some people go in seeing. They already think like this doctor is my answer, this medication is my answer, I'm good to go, no lifestyle change. So just realizing that there's a lot that you can do for yourself.
Yeah.
Um,
And I imagine, if for some people listening, we cover just, a really broad spectrum of things. So, it might be a little confusing or overwhelming to see, all of that. But, improving any of those things makes a difference. If you see any of those, not up to standard or just want to work on one of them at a time,
yeah,
everything helps. And
good
I
point.
think that's important to focus on as well, because even when you talk about 150 minutes of activity, I mean that can be overwhelming. And again, it's about the time that we spend and prioritization. And we talked about potentially spending 40 minutes on your phone a day, that you could
Yeah,
potentially be using to exercise or sleep better. That's just an example. But there are end goals, but whatever you can do to help improve is going to do exactly that, help improve.
yeah, absolutely. And that's pretty much just health and wellness in general. I mean, that could be a very blanket statement for anything. And especially just those really small changes. I like that you brought up we gave a lot of information. It doesn't have to be all of this. It doesn't have to be today. It doesn't even have to be tomorrow. Even if we get you thinking in a different direction, that might get you to move towards some of these healthier steps to hopefully prevent actual medicine in the future is kind of the end game here. So, Tim, I appreciate the time. Oh, did you have one more thing to say?
I'm just gonna one more point.
Yeah,
And I know that this is one thing that does hit home with people, financially and with the wallet, is your health costs. This is going to be a statement that is going to be hard to back up exactly with facts. But if you take care of yourself, you know the chances of your medical bills, of it costing you a lot of money, not just time and quality of life and things that obviously are hugely important as well, but it takes money directly out of your pocket treating those things too. Not just paying for medications, doctor visits, potential surgeries, all kinds of things. Even just, we didn't even talk about like smoking at all today, but that's something that the costs of being a smoker over 30 years, I'm
yeah,
paraphrasing here, so it's something like you'd put a kid through college, with
yep,
just like the costs of that. So I just think another thing that's good just to mention for level of motivation is, you know if nothing else, even if you're someone who's financially motivated, that is something that is directly affected by your health long term.
yeah. I'm actually really upset with myself because I am such a cheapskate and completely forgot about that aspect of things. So I'm really glad you mentioned that. Yeah, there's so much money that is dumped into healthcare. But not only money too, but like you think about the potential time from all the things that you're spending this money on. So the doctor's visits, the time away from kids and family and quality times of activity. Again, if you prevented yourself from getting to this point and to begin with, it, I mean, it speaks words. There's so much you can do. So awesome.
Mhm.
Cool. Well, I really appreciate the time, Tim. Thank you again for being on. I think we always have some good talks, and I'm sure we'll do something again soon. Let's see.